Our next speaker is Ms. Maryke Lundie, one of our own. She'll be speaking on radiopharmacists in South Africa, the current status. Ms. Maryke is an experienced radiopharmacist working at the Dr. George Mukari Sefako Makgato complex. Her focus on PhD research is radiolabeling of blood products with PET isotopes in collaboration with NEXA, NUMERI, and University of Pretoria. Welcome, Maryke. We're looking forward to your talk.
Thank you so much. Can you hear me? Okay, I'm tall, it seems. Okay. Just before I start, I just want to make you aware of my colleague, Ms. Lerato Mosima, if you can just do this. Yes. She's doing a PhD study about the accessibility of radiopharmaceuticals in English-speaking African countries, which fits in very nicely with Prof. Hasford's talk just now, as it will also include an update on all the information that he had about the status of nuclear medicine in Africa. Okay, so please remember, she's giving out these little pamphlets with a QR code so that you can scan and complete the questionnaire. Sorry, that's it. Okay, so if we get to my talk, just an update on the status of radiopharmacists in South Africa. So let me just go like this. Okay, if we start at the beginning, the practice of radiopharmacy, it has been defined as the science and art of the design, preparation, quality assurance, and clinical pharmacy of radioactive medicine. So basically, radiopharmacy combines the expertise of the pharmaceutical management cycle with the skills needed to actually handle radiopharmaceuticals. So it is very clear that radiopharmacists should form an integral part of the nuclear medicine team. In South Africa, it's classified as a scarce skill by the Department of Health, and it has been recognized as a specialization by the South African Pharmacy Council, the SAPC, for many, many years. Unfortunately, currently, there is only one practicing registered radiopharmacist specialist in South Africa, and then one retired, so not practicing anymore, registered specialist. We only have 3 institutions in the whole of Africa which offers radiopharmacy at a postgraduate level, and we can be very proud to say that South Africa has 2 of these institutions. So it's Stellenbosch University and then SMU, where I'm from. And then the other institution is in Morocco, so they offer a French-based postgraduate degree. This figure just shows you, in figure A, it's the qualified radiopharmacists in each country in Africa, and then figure B is the trainee radiopharmacists currently enrolled. So basically what I want to show you with this figure is just how well we actually compare, or how well we're doing in comparison with other African countries. So we are producing a lot of radiopharmacists. Yeah, we can be proud of that. So the SAPC specialist registration, the South African Pharmacy Council actually recognizes the need for specialist or specialty fields in pharmacy. So the goal for creating these specialist pharmacists are to recognize expertise in pharmacy, to create a career framework, being career progression and job satisfaction, to move the profession forward, to achieve better outcomes for patients, to establish a referral system within the pharmacy profession, to manage risk and public safety, and to support the training of academics. So you can see they are very clear in their aim and goals to create these specialist fields in pharmacy. If I can just quickly show you a little excerpt from where they speak about radiopharmacy as a specialist registration. So basically, we all know radiopharmaceuticals must be handled with care for both safety and efficacy. The dosage form, design, production, and manipulation are often highly technical, we all know that, and sensitive to poor handling techniques, which can render them ineffective or dangerous. So we need radiopharmacy as a specialized area to address this. They also state there that we need radiopharmacists in every academic hospital, nuclear medicine department, as well as private hospitals, but there are currently no posts for these professionals in the public sector. So this is from 2014. So at the moment, I'll get to that now. There are a few posts, but I'll show you now. But we also have the privilege of having major production facilities in South Africa. So that just further emphasizes the need for specialist radiopharmacists. Okay, so they also describe the scope of practice of a radiopharmacist. I'm not going to go through that in detail. Basically, the scope of practice of a pharmacist, but everything to do with radiopharmacy, so radiopharmaceuticals, sorry. If I can just quickly, one of the point J of the scope of practice says to provide education and training related to radiopharmacy. And just for interest's sake, if we look at that, in MED programs throughout South Africa, the University of Pretoria, Stellenbosch University, University of Cape Town, and University of KwaZulu-Natal are the only institutions in South Africa that actually make use of radiopharmacists to teach in their MED programs. So what about the other institutions offering MED degrees? If we can emphasize the value of a radiopharmacist already at MED level, I think that will also improve the status of radiopharmacists in South Africa. So in nuclear medicine radiography, in general, radiographers are taught by other radiographers, so only the Cape Peninsula University of Technology actually employs a radiopharmacist to teach in their program. Okay, so if we go back to the South African Pharmacy Council specialist registration, the criteria for appointing assessors of the applications. Assessors in the field of radiopharmacy must have a suitable background with a proven track record and relevant experience to enable them to make sound judgment through the expert application of the assessment criteria specified for this qualification. So all of this is background to get to the point of where we stand at the moment and the challenges we're experiencing. Okay, the specialist requirements from the South African Pharmacy Council to actually register as a radiopharmacist in South Africa is that you have to be registered as a pharmacist with the SAPC. You have to have an approved master's or equivalent postgraduate degree in radiopharmacy, and then you have to have 2 years practical experience in a field of radiopharmacy or in a radiopharmacy setting, and proof of that practical experience. So this is where we now come to all the challenges that we are experiencing. So like you saw in the figure that I had, we produce a large number of radiopharmacists, but it doesn't help to just keep on producing them if there's no jobs for them. Okay, so a lot of them can't even apply as specialists with the South African Pharmacy Council because they can't complete the additional 2 years experience that they have to have post-qualification. So without the official recognition, the employment opportunities are minimal, and these graduates are lost to other fields of pharmacy. So it's kind of a vicious loop because we need jobs to be created for radiopharmacists, but these radiopharmacists have to register as specialists. They are not able to do that because there's no jobs for them to get the practical experience. Okay, so it's kind of a vicious cycle. So like I said, we have 2 SAPC registered specialists in South Africa, one practicing and one retired. So the assessor pool is also very, very, very small. There's only those 2 that qualify according to the assessment criteria that I showed in the previous slide that actually qualify to look at these applications. The one practicing SAPC registered specialist actually registered in 2007, so that's many, many years ago, which means in the past 16 years there has been no further specialists registered. Even though we have produced, like I showed, since 2009, 34 graduates just at SMU for this degree, for a radiopharmacist. So in the past 5 years, there's been 5 radiopharmacists who submitted their specialist applications to the SAPC, but with no significant action from the SAPC. So the latest communication we got was in February this year, where they said the council had requested that the evaluation process be reviewed. So this is very, very frustrating. We have so many radiopharmacists qualifying to register as specialists and to take their place in South Africa, but we are stuck. So the solution. In my opinion, we just need support from all the relevant parties to try and push the South African Pharmacy Council to take action. So I said SASRM here, that would be great. If we can have the support from SASRM. Also the Pharmaceutical Society of South Africa, training institutions. Yeah, so all of these people to request rapid action from the SAPC because it's kind of frustrating. And this is needed, the registration as specialist, because of the general expansion in nuclear medicine in South Africa over the last few years. There's also increased complexity of radiopharmaceuticals. I think that's a lesson that we're all learning at this conference, that things are growing very rapidly in a very exciting direction. There's role substitution. So the radiographers are doing a fantastic job, but they are completely overwhelmed in most departments, and they're being overexposed. So we actually have a student with a poster that's being shown here about the need for extra staff in hospitals where there is no radiopharmacist. So Numera is coming on stream, also very, very exciting, but also another factor to emphasize the importance of radiopharmacists. Then SAPRA's good compounding practice guidelines. It's being prepared at the moment, sent out for comment, so it's going to be published soon and possibly enforced. We're not sure how yet, in the near future. And these guidelines also include the sign-off or direct preparation of radiopharmaceuticals by a radiopharmacist or by a pharmacist. Okay, and then there is a lack of radiopharmacy posts on the Department of Health side, which will probably improve if the specialization is in place. So another suggestion that we've had for quite a few years is to actually create community service posts for pharmacists who finished their degree and did a master's degree in radiopharmacy, to create community service posts in nuclear medicine departments so that they are not lost to normal pharmacy for a year, and then some of them really struggle to get back. And remember, nuclear medicine is growing so fast, if you're out of it for a year, you kind of lost a lot of your skills and knowledge. Okay, so there are a few job opportunities in South Africa. We are privileged to have this. We have NEXA and NTP, AXIM, academia. The academia can definitely improve with posts at the institutions that offer MED and nuclear medicine radiography programs. Numera, Itemba Labs, private cyclotron production facilities. And then I just want to say, currently there are only 2 hospitals in South Africa with an actual radiopharmacist post. And this is crazy. If we see how many nuclear medicine departments we have, there are only 2 posts. So ideally, we need 2 posts in each nuclear medicine department for radiopharmacists. I think that's it. Yes, I'm quick.
Thank you, Maryke. I think it's important to congratulate you and Prof. Summers and team for the immense contribution that you guys have done towards the training of radiopharmacists.